Good evening, everyone. My name is Annette Campbell Anderson, and I am your moderator this evening for a discussion about gun violence in our schools. This is a timely topic as we prepare for our schools to reopen. Some of our schools have already opened across the country. And so we want to have a discussion this evening to talk to some of our experts about the impact that this is having long-term and ways that we can think about reframing violence in our schools. Tonight, we have two experts who are with us, and I'm going to introduce them momentarily so that we can begin our discussion. First, I'd like to introduce Dr. Vanya Jones. She is an associate professor at the Johns Hopkins Bloomberg School of Public Health in the Department of Health, Behavior, and Society. Her academic career merges health education and program development to reduce the burden of unintentional and intentional injuries for underserved populations, including children and older adults, and communities with limited resources. She received her undergraduate degree from Bowling Green State University. She has a master's in public health from the University of North Carolina at Chapel Hill. And her PhD is, of course, from the Johns Hopkins Bloomberg School of Public Health. Welcome, Dr. Jones.
Thank you, Dr. Anderson.
Our second guest this evening is Dr. Joseph Sakran. Dr. Sakran is a trauma surgeon, a coalition builder, policy advisor, public health practitioner, and nationally recognized advocate for gun violence prevention. He is currently the director of emergency general surgery, an associate professor of surgery, and associate chief of the Division of Acute Care Surgery at the Johns Hopkins Hospital in Baltimore. He hails from Fairfax, Virginia, where he was the son of a Palestinian father and a Lebanese mother. He attended George Mason University for his undergraduate degree. He then went on to the Bloomberg School of Public Health for his master's in public health. He also attained an MPA from the Kennedy School of Government at Harvard and his MD from the Ben Graham School in Israel. Welcome, Dr. Sakran.
Thanks so much, Dr. Anderson.
So as we get started this evening, I really want to begin with a little bit of personal insight into this issue around gun violence. Dr. Sakran, I'd like to start with you this evening. Can you talk to us a little bit about your personal experience with gun violence and tell us how that may have impacted your professional trajectory in becoming a trauma surgeon?
Yeah, well, thanks so much, Dr. Anderson, for having me. It's great to be on with everyone and to be on with my colleague, Dr. Jones. Look, right now, I think in America, we're probably facing one of the most important public health problems of our time. And it's hard for me to talk about gun violence in America without talking about my own, story and why I'm even here, doing the work that I do. And for me, it really started, as you mentioned, being born the son of immigrants right outside of DC in Fairfax, to, parents that really just did everything that they could to try to give us, all the opportunities that anyone could want and that they could have never even imagined growing up. And one of the things that really, I think, changed our lives as a family was the fact that when I was 17 years old, I was nearly killed after being shot in the throat with a 38 caliber bullet. And I think that, I don't know how most people on this call were at that age, but I think most of us at 17, we have no idea what we want to do in life. We may not even realize that we're mortal. And when something like that happens, it really kind of changes your whole perspective, or at least it did for me. And I'll just, quickly tell you, I remember, you ask like, well, how did you kind of get here? I remember this very distinct moment. I had a very severe tracheal injury. I have a paralyzed left vocal cord, and I had a tracheostomy tube for about 6 months, and I had these big red scars up and down my neck. And I remember standing just a couple months after my injury, I was standing in the mirror. And what I didn't realize was my father was in the corner. And I think, like any parent, I think, Pops saw that look of devastation in my eyes. And he said something that I honestly have never forgotten and really changed my entire trajectory. He said, listen, he said, Joe, he said, you have two options. One is you can feel sorry for yourself because of course what happened was terrible. And I think that was like tough love, especially from like an immigrant dad. Or you can take this terrible experience and turn it into something that potentially impacts the lives of other people. And that's, really, I think the moment, Dr. Anderson, that I was inspired to go into medicine. I was inspired to become a trauma surgeon. And initially my goal was, to be able to give other people the same second chance I was given. And what I realized over time was that, while, I love the work I do as a clinician, the best medical treatment is prevention. And that's what got me thinking beyond the trauma center, beyond the operating room, working at, the intersection of medicine, public health, and public policy.
So I didn't realize that you were so young when this happened. To give us, as an audience, a little bit more about your frame of mind as you were trying to recover and think about, how you were going to move forward at that time through what was obviously, just such a shocking and difficult situation.
Yeah, it's interesting you ask that, because I think everyone deals with adversity or grief in different ways, right? And there's been a lot of time that has passed in between when I was injured and now my ability to talk about my story and why I talk about my story. And as we were, I think a couple of us talking, before this started, when I think it really crystallized for me about the importance of my own story and how I can use my story to kind of impact the narrative, right? And turn that narrative into action, was in the work that I was doing when I was a fellow at the University of Pennsylvania. And we would bring in these students from the surrounding community, 14, 15-year-old kids, right? And I'd give them a tour of the trauma center, and then I'd talk to them about gun violence. And the first time that I did this, again, they're young kids, so like they're kind of paying attention, but like not really, right? Let's be honest. And I hadn't told them my story yet. And I went ahead and I told them my story, and all of a sudden, after I did that, all of their eyeballs focused on me. And it was a reaction that I had not seen before, and one that I wasn't expecting. And I think what that did was it demonstrated to me how I went from being this guy wearing a white coat to someone that could relate to what these kids were facing in their communities on a daily basis. And I think that's the power of story. I think we have to remember that, whether we're in healthcare or education, the ability to translate that data and science into stories, into things that people understand, because that's what really is going to change the hearts and minds of individuals and allow us to move the needle forward.
I want to thank you for your bravery in sharing that and being transparent, because I cannot imagine that it is easy to have to relive that and to have to share it. But I also want to thank you for your bravery, because you just never know how far your words will travel to impact someone, just like your father's words impacted you. So I really want to thank you for just being open and sharing that. And I'm sure that our audience may want to return to some questions about that later. So just thank you. Now
Thanks.
I'd like to turn to Dr. Jones. Dr. Jones, your research has been with communities of color, specifically here in Baltimore, looking at curbing violence in school settings. Can you give us a little bit more insight about your research and how impactful it has been in terms of our community?
Well, I first want to start by echoing your thanks and gratitude to Dr. Sakran. I am humbled to be on a panel with him. I think the work that he does is amazing, and really think that the relationship between who you are and the work you do is extremely important and helps drive the your advancement forward. And I'm going to share something that I didn't plan on sharing, thanks to his bravery. I've done a lot of work with schools, and the reason that I've done work with schools is you rattled off all the schools that I went to. I'm a true first generation college student. My parents did not go to college. My father, in fact, graduated from college 2 years before I got my PhD. So I experienced him going through undergrad while I was getting a PhD. And I remember him saying, "Don't come to my graduation." And I was like, oh my gosh, do you think this is the best excuse not to be in school, is to be like, I'm going to my father's graduation. And I say that because when I started my work here and started working with schools, I've been doing work with schools in my entire career here in Baltimore. The reason that I wanted to do it is because I wanted to let young people who look like me see that this is possible. And I'm at sort of one of the premier schools of public health in the world. I am a public school grad. I went to all these public schools, and I wanted to sort of share that. And when I started doing that kind of work in schools, and I'll talk a little bit about my work, especially around violence, one of the questions that I would ask young people who got suspended or expelled for violence in my work, I'd say, why'd you do that? And the response that they would give me was, because my mother or my father or my caregiver told me, don't let anyone disrespect you. Mm-hmm. I heard that over and over and over again, because early in my career, I didn't want to work with parents. Thought we can work with schools. Schools could make it right. And it was through my work of talking to young people that I realized parents, and Dr. Sakran, your statement around your father and what he said just underscores what I've learned from the young people that I've worked with here in Baltimore. Parents and caregivers and adults in your life who care about you really are extremely important to your development, and truly how schools can help make young people thrive and become the adults that we want. So I'll start there. So I shared my own personal story to sort of say, one of the ways my research has pivoted over the years is working with parents. When I heard those young people say to me, my parent told me not to be disrespected, I would then push and go, well, what did that mean? Did that mean get into a fight because someone knocked your pencil off your desk? And tell me what that means. And I began to understand that parents were telling their children, I want you to be safe. And in some ways, and I think in a lot of ways, leaving it up to the 12-year-old and the 13-year-old, and let's be honest, their decision-making skills aren't always the greatest, of what that means. And so one of the things that I started to do in my career is, how do we work with parents to both clarify their messages to their young people, especially when it comes around to something as serious as violence, but also understanding the importance of the role of parents in schools. And I've done a lot of work lately around parents in schools and school engagement and what that means. And a lot of communities and the research out there really talks about parents volunteering and having to be at school for long hours. And I'm here to tell you that's absolutely not true. The research that I've done with families here in Baltimore says being able to understand your child's homework, being able to call your child's teacher, knowing that you can have a relationship with them is just as important as volunteering. It's knowing that there is a relationship with the school that your child goes to, and you as a parent, that makes a difference for that child to know that when things go wrong, there's a catchment that's going to help them. So one thing that I do is work with parents, particularly parents engaging in schools. I've also done a lot of work with mentors. That's where I started, is thinking that you're working with mentors across the city and across the state would really help fortify the relationship of young people to adults, which we know is extremely important. Having a caring adult in your life makes all the difference. It made the difference in mine. And I think it's, when I started doing that work, it was also important to help those mentors understand, how do you talk about violence with young people in Baltimore? That's their context. We can't ignore where these young people live and the high rates of community of violence that they experience and pretend like it doesn't happen. In order to talk to these young people, you need to honestly understand where they're coming from. So I've worked with some colleagues. Dr. Sakran knows some of them, other emergency room physicians. I'm thinking of Dr. Letitia Ryan, who has really spent time to think about, how do adults talk to young people in their lives about violence, especially when we're not from the communities where they're from. It's important that we understand and we don't put ourselves in those shoes. We put ourselves in their shoes and don't pretend to know exactly what they're going through without hearing their voice. And then the third thing I've done, and then I'll turn it back to you, Dr. Anderson, is work with school-based health centers. So schools have nurses, they have school-based health centers. Schools do a lot of really great stuff for young people in our communities. They are the fundamental cornerstone of helping them become adults. I am grateful for every teacher and administrator who works out there, especially those in Baltimore City. I'm also grateful to those nurses in school-based health centers who are the first line health system that a lot of young people encounter in their way to becoming those adults. And school-based health centers have a lot of relationships with parents. They're different than the relationship in some instances of teachers, and they provide a health sort of lens and think about the health of an entire school population. Mm-hmm. that is a frontline healthcare worker if I've ever seen one, and their understanding of the relationship between health and education is fundamental. So those are some of the ways I've worked with schools and to help elevate ways that we can reduce violence in schools. And I'll turn it back to you, Dr. Anderson.
Dr. Jones, thank you for sharing that. I think it's just really fascinating as I listen to both you and Dr. Sakran talk about the centrality of relationship to students feeling safe in their capacity to be vulnerable in school, because the rule of school is that you don't put your hand on other people's children. The rule of school is that you tell an adult. But what we're here today to talk about is this very notion that there are young people who feel that they can no longer trust those rules, those bedrock foundation rules of our schools. Now, you know, I'm a former principal. You know that I have lots of educators who are probably listening in right now and starting to ask questions. But what is the role of adults in helping to keep our young people safe? Because so much of what we are seeing is coming from our young people feeling that they no longer are safe in their school. So I want to turn to you, Dr. Jones, Dr. Sakran. I want you to also weigh in on this, because this notion of how violence really becomes an overarching theme in our schools really has to go back. I always think that it has to go back to the adults who are responsible for making our young people know that they should be safe in our schools.
So I'll start with sort of a very overview answer to that question and say, Dr. Anderson, you're absolutely right. One of the things that we know, so the foundation of a lot of my youth violence work actually is fighting. Some would say fighting is a trajectory onto more serious violence. Some would say it's not. There are lots of schools of thought around that, but we know the more serious the injury, if you're in a fight, the more likely you are to retaliate. Why do I bring that up? I bring that up because in schools, we know conflict is going to arise. That's a part of development. That's a part of working with other people. We also know that school connectedness, so my relationship to my school as a young person, is fundamentally hinges on my relationship to the people in that school. And so if I feel like I have a teacher, a coach, a mentor, an administrator, someone in that school who is on my side and is going to listen to me fairly, regardless of what I have going on in my life or who you think I am from my background, I'm more likely to feel connected to this institution that is fundamentally a part of my development. And so I start there. It's one of the reasons I started working with mentors, is because we can place mentors in school. We can also look at them as coaches, and the importance of those adults in a young person's life. From the youth fighting work that I do, the more likely a young person has to go talk about their problems, whether they're conflict-based, developmental-based, school-based, you have it. Let's all think back to when we were young and we were in the 6th or 7th grade, you had some challenges and you wanted to go talk to someone. We know that having that someone in school helps a young person to navigate their world in a way that reduces the likelihood of violence. Dr. Sakran, I'll turn it over to you, but I just wanted to sort of agree with that adults are part and parcel to this problem.
I completely agree with that. I have so many thoughts. Let me see if I can kind of distill them quickly. So I would first say, just think about globally what's happening across the country, right? Like every year, it's estimated we have like 3 million children, right, that are exposed to shootings per year. So it may not be a surprise that the American Psychological Association found that 75% of the children are afraid to go to school because of a school shooting. Like that is our reality. And you know what? We as adults have, I think, the opportunity and the responsibility to be part of that solution, right? Our kids should be focused on getting an education and all those things, Dr. Anderson, that you've done, throughout your entire career to try to kind of build that bedrock foundation that is so critical to the success, the future success of these kids. And it's not happening. And I'll tell you that, there's a lot of different, I think, ways to approach this. And I love, Dr. Jones, you're talking about, the reality of what's happening kind of on the ground and, the arguments and the discussions and how do we empower our youth to be able to tackle some of these. There's a lot of great, I think, examples of this. And I just want to give two quick examples. One is there's a program that's done out of Atlanta right now by Joshua Berg. And it's through 100 Black men in Atlanta. And the program is De-Escalate or Die. Some of you may have heard about this. And I was just with Joshua this past week in Atlanta. We were with the former Surgeon General, Dr. David Satcher, talking about how we can tackle this complex problem that disproportionately impacts young brown and Black men. And one of the things that they do is they go into schools and they try to have these different components of tackling, and teaching kids how to kind of break down some of these problems. And part of it is the de-escalation training that they're doing in public schools, which means being able to use, your communication skills to kind of turn down the heat of a disagreement or conflict, right, before it becomes violent. There's also some local, I think, examples that I think about, like my dear friend, Uncle T, who has a nonprofit called Challenge to Change, right? Where some of you probably, have interacted with Uncle T, right? He is focused on trying to positively impact at-risk youth. And if you go to his center, he says something that has resonated with me so deeply. He said to me one time, he said, we were breaking bread. He said, Joe, he said, do you know what I call love? And I said, no, Unc, what do you call love? And he said, time. Because it's the time that we spend with these kids that really makes a difference. We have to move away from, this burden being on the shoulder of a few people, and we all have to be part of that solution. There is no one fix. It requires us to think innovatively, broadly, and to have a multifaceted approach. And until all of us step in and really start to become part of that solution, we're going to continue to see this crisis unfold in America.
Can I say one more? Have a response. I think what can I just call you Joe? Can we drop some of the formalities right here? I think what Joe really sort of to elevate is how this shows up as a public health problem, right? So it's multifaceted. It has lots of different components. It is not a healthcare problem. It is not a police problem. It is a problem of how we handle it systemically as a community, and that is an underscored public health problem. And some of the work I talked about mentors. So this is some of the work I've done is pairing young people who went to the emergency department as a result of youth violence. Now that could be gun related. It also could be you got into a fight and you got cut really bad because you fell and hit your head on bricks. And everything in between. And when we pair that young person with a mentor and we provide the mentor with some coaching and some discussions to have with that young person, one of the things that we learned really early on, and I love that Joe pointed this out, which is time with young people. One of the things that we learned really early on is when a young person comes from a community like Baltimore, where they may have challenges because of all of the things that they have going on in their community, being able to understand that I'm angry or scared and what that emotion shows up like in my body for me in talking about de-escalation is sometimes where we just need to start. And young people need that time and the sort of protected space with an adult to be able to say, I often tell young people when I'm working with them, I start to sweat, like literally my armpits, I start to sweat. Maybe I wasn't supposed to say armpits on a live stream Facebook video, but they start to sweat. And when I realize that's happening, I know something's happening to me that's going to escalate my emotional response to the situation that's happening right now. I'm here to tell you that a lot of young people in Baltimore don't get the luxury of having that process in order to do just what Joe mentioned, which is have that time to talk about what does de-escalation look like. So some of the work that I've done with mentors is let's help them have that space. Let's give them the opportunity.
So I thank you for that, Dr. Jones. And I want to push a little bit because the reality is much of the gun violence that's happening in schools, it's not happening in places like Baltimore. It's not happening in our big urban cities. It's happening in places like Parkland. It's happening in affluent places like Sandy Hook. It's happening in places like Uvalde, Texas. So what's going on that as you talk about this anger issue, these issues around these mass casualty shootings, they're not happening in our urban public schools. They're happening in suburban schools. What's going on there, Dr. Jones? What do you think about that, Dr. Sakran? Why is this happening? And as we talk about the role of the trusted adult, what should adults be looking for so that they can step in, so that we don't have this happen again? What we don't want to have happen in 2022 is another mass casualty shooting.
But let me just pop in here real quick.
Yes.
I think we got to be. I partially agree with you, Dr. Anderson. I'm gonna push back a little bit.
Yep.
Here's the way I'm gonna push back is that I think gun violence, right? When you think about gun violence in schools, it has a lot of different forms, right? There's incidents of gun homicide and assaults. There's gun suicides. There's unintentional shootings, and then there's the mass shootings, as you described, right? And in fact, when you look at like some of the data and you start to track some of the data as it relates to US gunfire on school grounds, right? What you find is that there's a high proportion of students of color, right, that are disproportionately impacted, even with these school incidents. It may not be the ones that, you know, aren't necessarily highlighted by the media, which is such an important point, because let's be honest, it wasn't until white suburban schools started getting shot up that people started paying attention. And even when you look at mass shootings in general, right, mass shootings comprise less than 2% of the public health problem we face. And as you know, right, and so many people probably listening, in cities like Baltimore and Atlanta and Philadelphia and Chicago, we have young Black men that are being slaughtered on our streets and coming in through our trauma centers every day. So we have a responsibility to tell those stories. We have a responsibility to elevate, you know, folks in the community, right? Because the people in the community, those that are closest to the struggle, they know what the solutions are. They don't need some Hopkins person, right, to come and tell them what the solutions are. No, they need a true partnership. And that's what we've tried to do, is like, how do we partner with, you know, everyday people from the community and elevate their voices, because they know what needs to be done. So I would say it's very complex, and that's why it depends on how we look at the data. And how we look at the data is going to allow us to better understand tailoring our solutions to the specific type of gun-related injury that we're trying to focus on, whether it's urban violence or suicide and so forth.
But we know that the facts tell us that this last year was the highest number on record of shootings in public schools, that we had 93 shootings in our public schools. And this is the first time that's ever happened. So, and most of those were not urban schools. So where I come back to this with you, Dr. Sakran, is what should adults be doing if there is this epidemic of violence that's happening? And you spoke a moment ago to partnership and the need for that, and this role of the trusted adult. What should we be doing as adults to help? And Dr. Jones, you spoke a while ago about the mentors and how they help with this same idea of becoming trusted adults. What should we be doing, and what should adults, even trusted adults, what should trusted adults be doing to help to bring down some of the anger that you've talked about that leads to these situations of gun violence?
I start before we came on. I asked Joe if it was okay, and Joe, by the way, call me Vanya, please. If it was okay that we talked about the issue of gun access, because there is an elephant in this room, and you don't get gun violence without guns. And I loved your response. I could give my own, but I loved what you said when we were just having a brief conversation before. And I want you to, if you don't mind, share with everybody else, because I think it helps to start with some of this answer that Dr. Anderson is giving us, or Annette is giving us.
Yeah, I mean, look, so in my mind, right, I think, Dr. Anderson, you're spot on. It's like, okay, we have this public health problem that everyone is talking about, but so now what? Like, what is the action-oriented piece, and how are we different than so many other countries? And I think it comes down to the fact that we have easy access to firearms in this country. And the way I was describing it to Vanya earlier was that if you think about access, right, if you were going to put a graph out there, you put access in the middle, right? And then you have like this hub and spoke model where you have access plus hate. Okay, Buffalo. You have access plus impulsivity, right? You have access and you suicidal ideation. You can keep going around. Access, I think, is central to it. Okay, so fine, access is central, but going back to your question, well, what are we going to do, right? What are the adults in the room going to do? Well, I think there's a variety of things. First of all, let me just say that, you know, we just saw the Bipartisan Safer Communities Act that was just passed and signed by President Biden. Look, that piece of legislation is tremendous. It's not everything, but it's a step in the right direction. And it includes things, to your question, like extreme risk protection orders, right? Which are policies that help empower family members and people that know individuals that are struggling the most to help them temporarily, you know, prevent a person from accessing a firearm. So that's one example. We need to work on those things like, you know, secure storage, right? And child access prevention laws. You know, in my mind, we need to raise that minimum age for semi-automatic, you know, firearms to 21. We need to expand the background check, right? And have the permit to purchase stuff that we talk about. We need to ensure that we're having, you know, healthcare systems all across the country develop hospital-based violence intervention programs, which we know are so critical because, you know, while some of us talk about the deaths all the time, we know that for every death, there's 2 to 3 non-fatal injuries that happen. And guess what? 40% of those people are going to come back in 5 years with another injury. So that's an opportunity for us to reduce the recidivism. And then finally, I would say, you know, is we need to, you know, really think about how are we creating a safe climate for our students, right? And of course, educators like yourself can probably speak to this way better than I can, but I think there's a lot of positive things and relationships that we can do with the school surrounding community that has not been tapped into. And that's why, you know, people like Randy Weigarten from, you know, the AFT, right? And so many others that have been out there talking about, you know, building these community partnerships is so critical because that provides the support that students and I would say families also need to be successful. Because let's face it, you got these single moms that are working 2 jobs to put food on the table. I don't blame them that they can't be there every second. So how are we going to help them?
Right. And so I'm going to echo everything they said, which is why I wanted him to give that answer because, we started that discussion, but I think that the point that he's making and the one that I talk about all the time, so get involved and how you get involved. He just talked about policies and, sort of policy decisions and decision makers. I beat the drum of vote when you can and hold the people accountable who are making the decisions for your communities. I think there's a lot of really cool stuff that's happening in Baltimore. I think there's a lot more that we can be doing to support our young people, particularly in schools. And the only way we do that is for the collective voices of parents and the other people in community. So I know Joe didn't mention voting as a part of, sort of mobilizing the community around schools, but that is a constituency that we have power and we have the ability to hold the people who are in office accountable to that type of work. Things like raising the minimum age, things like having policies that provide positive youth development programs for young people after school, in school, during school. We have that power, and that's something that we need to be shifting and focusing our efforts on.
Well, I want to thank you both. I think that the audience is really starting to send in some powerful questions as well. And so they are reacting to what both of you are saying, which is truly, truly powerful. And I want to thank you. Dr. Sakran, you are a trauma surgeon. And you just spoke a moment ago, and I think it was so poignant that you said, for every death that we have from gun violence, we have 1 to 2 who survive it. But there's still trauma that is associated with that. What don't lay people really understand about how that trauma really impacts the life course, even as they survive the physical injuries, what it means for young people who get involved in one of those scenarios and is trying to come back from that?
Yeah, it's so important. So, for every death, there's about 2 to 3 non-fatal injuries, and those numbers are conservative. right now there's actually a large nationwide study being done to better understand the scope of non-fatal injuries. And the reason those are conservative numbers is because depending upon the hospital that you're a part of or the state that you live in, you may or may not capture all of these. So if you think about someone, Dr. Anderson, that comes in, right, with like, say, a flesh wound and gets discharged from your emergency department. Well, you may say, well, okay, well, you know what? They didn't have a life-threatening injury. They're fine. You know, we're going to discharge them. But the physical part, of course, is, you know, one piece. But then, as you alluded to, there's this mental and emotional component that is something that, frankly, I think we have not thought about until recently in a way that has really been meaningful. And it's one of the reasons that, in, again, the Bipartisan Safer Communities Act, there's, I think, around $15 billion invested in mental health. We know that the individuals that are involved, right, and that are impacted by gun violence, they require access to mental health post-injury. And we're just starting to learn how actually long that extends. It's not just like 1 or 2 months. And for everyone, it's going to be a little bit different. The numbers that are coming out are pretty dramatic. I would also say that it's not just the individual that has been shot. Think about their families and their loved ones, right? And what they've gone through, knowing that they almost lost their child. The last kind of piece, which I think is just so critical to this overall, you know, kind of process, is to think about, okay, if we have these people that are coming in with non-fatal injuries, how do we break down this revolving door of violence, right?
Yes.
How do we break that down? And I think part of it is, you know, when you think about these, what we call HVIPs, right? The hospital-based violence intervention programs. There's the intervention piece, which happens, you know, either in the emergency department or during the hospital stay. Then there's like this like long-term kind of, you know, community-based management service that happens afterwards. And then hopefully there's a follow-up service where we include things like linking, you know, folks up with community-based services, mentoring, home visits, and so forth. But then the other piece is addressing, you know, what many people have called the social determinants of health, but I perhaps will name the political determinants of health, because only policy can fix what policy has created to, you know, to begin with. And that's a whole nother discussion we can get into if we have time. But I think it's those components that allow us to really comprehensively look at this and try to address not just the physical aspect, but also the mental and emotional piece.
That's really powerful. I want to turn to you now. Thank you so much, Dr. Sakran, because now I want to go to Dr. Jones. I want to ask a little bit about this culture of gun violence. So one of our guests who's watching on Facebook wrote, how do we address the culture of gun violence committed by a majority of teenage boys who have shown signs of antisocial behavior? So I'm going to throw it to you first, Dr. Jones, and then Dr. Sakran. I'll let you round it out at the end.
Well, I want to echo the thing that we talked about earlier, which is gun access. And gun access looks different for different communities. So if we talk about who owns a gun and how they get a gun, that varies based on the community, sometimes based on the community that you live in. And so I think the first thing I would talk about when we talk about young men and guns is, in fact, you know, what is the influence of them having access to a gun, and how does that get addressed? So again, I want to always underscore there is an elephant in the room with gun violence, and that's having a gun. The second thing is, and I think, you know, we talked a little bit about this, young men, particularly young men in communities like Baltimore, and their access to schools, their access to jobs, their access to, you know, what we would call pro-social youth development programs start to wane in some instances as they get older. So we know when you're in elementary school, you have more access, you're more engaged. It is always heartbreaking when I hear an elementary school student, which I've worked with elementary schools, where they'll say something like, this kid was absent 20 times this school year. I know no elementary school kid who's just wanting to be absent that much from school. That is a social issue that child doesn't have access to. And if we theme that through as they get older, what you're asking, I think what that question asks of me is, how did this young person get here? And this young person gets here because in the discourse of them growing up, and they get to, and let's just face it, it starts in middle school. And gets more progressively as they get older. We see, young people get involved with gun violence, particularly males, grow as they get older. The issue for me is, how did we fail them and give them the opportunity to be out in a community where they have access to guns and they're solving their problems using gun violence. I'm going to talk about a program that I have never published on. I work with the health department on doing violence interruption in schools here in Baltimore. And when we started doing that work, we were training violence interrupters that work in the community, and we were working with schools to train violence interrupters. One of the challenges with that is it's a credible messenger model that's created for violence interrupters that's in the community and not necessarily in schools. And what we discovered is a lot of our violence interruption, if you will, which I'm going to call conflict management, was between students and adults in the school. It was this mechanism to be able to give young people a way to talk about a challenge they're having with an adult. Now, I'm going to theme this back through the question of young people, gun violence, and gun culture. I think there are a lot of social, and I liked Joe's comment of political determinants of health, that make it prevalent for young Black males in Baltimore to not be involved in school, to not give them opportunities to build in all of those holes that I mentioned that takes an elementary school student to a young person who's dealing with a gun violence issue, and all of the things in between. These young people require supports. If we're talking about issues of food access, stable housing, families that have experienced incarceration and gun violence themselves, we're asking a young person to deal with very complex problems that we as adults wouldn't be able to handle. I know that's a big nebulous answer to that question, but I think labeling a young Black man as somebody who's hyper violent with guns is unfair to them and doesn't consider the context that gets us there.
Yeah, it's such an important point, and maybe I'll make 3 quick points. The first is, I think we have to talk about the adverse childhood experiences as part of this. And I think Dr. Jones kind of alluded to this, right? These, potentially, traumatic events that happen have significant impact for these kids as they grow up. And what's interesting is the impact isn't just, mental health impact, but it's also physical impacts like chronic hypertension, diabetes, obesity, right? Just specifically to your question about culture, I think the one thing about culture that people have to realize is it doesn't change overnight.
Yeah.
It is so hard to change culture. You think about the temperature in our country, it's changed over the past 10 years. When you look in like 2008, there were 63 democratically elected members of Congress that had an A rating with the NRA. In 2018, that number was 3, and I think it's now 0. The point is that we've shifted, and while it took nearly 30 years to finally pass federal legislation, states all across America have been passing common sense gun legislation, right? So people are not willing anymore to stand on the sidelines of history as kids and youth and other folks continue to be killed. Part of that cultural change I would like to see, and that I've recently been working on, is how do we get other folks to be part of that, such as TV and film. The entertainment industry could play a huge role, right? If you think about, trying to incorporate and implement gun safety methods, and that's something we're currently working on. Mm-hmm. And then the last piece I just have to address is the piece that really Dr. Jones, I think, is alluding to, which in my mind is about structural violence, right? It's about the structural racism that we see. You think about the Homeowners Loan Act, right, which was part of the New Deal under which the practice of redlining came about, right? The combination of discriminatory policies, right, that are layered on top of structural racism has created a vicious feedback loop, right? Poverty and limited opportunity leads to increased crime, violence, and incarceration, which then further poverty and weaken efforts to invest in the community. We have to do better to kind of break that cycle. And I think there's we can talk if we have time about ways to think about that.
So I want to thank you both for your responses. I want to move on to a new topic from one of our guests, which is social media and the role of social media in the proliferation of gun violence in our schools. So we know that social media has such a profound influence in ways that our generation, we didn't grow up with social media. I'm aging myself a little bit, but for so many of our young people, social media is such a huge influence in their day-to-day existence. How does social media continue to lift up and glorify the culture of gun violence that sometimes makes its way into our schools?
I'll try to be succinct in my answer this time. I know I've been a little impassioned with my responses.
It's great. It's great.
I'll go back to some of the work that I've done in schools with de-escalation, and it's really interesting when we talk to administrators that there was a conflict going on under their noses and they didn't know because the entire conflict was playing out on social media. Parents knew and found out, or community members knew and found out, but no one in the school really knew because the escalation wasn't happening physically in front of people in a way that you could see it. And I think therein lies one of the challenges that we have today, especially for schools, when it comes to the experience of young people in schools and how there's a much larger complex web of communication that's happening. And that complex web isn't just, TikTok or I don't think young people use Twitter anymore. I think they get onto their new platform. It's not only going on in those spaces, it's also in other areas that we wouldn't think to look, like, shared gaming systems, right? So like these different spaces where young people spend time socially online. And this gets to, again, how do we work to provide safety for our young people in these spaces that we didn't grow up with, that there is very little, let's be honest, legislation or community controls over, and it'll require disclosure from your young person that this is happening in a way that they feel safe and comfortable to share. And so I highlight that because I think one of the things that violence prevention programs, especially ones that partner with schools, often miss is the importance of social media from all of these platforms in the work that they're doing. If you're not talking about social media in this day and age, when it comes to violence and conflict and escalation, you're missing probably 2/3 of the problem.
And I would just quickly add just a couple quick things. The first is I think there's definitely some role. I think we also still don't understand the full impact of that role, and more work needs to be done to really kind of peel back those layers. What I'll tell you is, there's always a movement where those of us in the gun violence prevention community, after a mass shooting, for example, that gets a lot of media attention, we're very, I think, careful and push the media not to use the person's name, because a lot of these individuals want the notoriety, right? So we don't want to give them that, because we're trying to kind of minimize, this kind of emblematic, process that happens that is just, I think, very cataclysmic when you think of how these people are portrayed. I think the other piece, though, is other countries, have social media. Other countries have the gaming systems. They're not seeing the same thing, right? This goes back to what we were talking about, which is the ubiquitous access, right? Of, having 400 million firearms in this country and being able to easily get your hands on it. That is a significant part of the problem. So I don't think we can blame the whole thing on social media, although I do think it does play a role.
I didn't want to say one more time, there's an elephant in the room and that elephant is access to guns, but we can say it one more time.
Thank you for reminding us of that. So we have another question about mental health, and Dr. Sakran, this is for you. The viewer says, Dr. Sakran mentioned an increase in spending for mental health, but we still see so many schools are underfunded. What additional procedures can we implement to curb all forms of violence in our schools and hopefully within our larger communities? And what role does mental health play in that?
Yeah, so I think a couple things. I think when you think about, so it's so important we be clear when we're talking about mental health and gun violence, because I think the tendency is when these events happen, you hear, people that are just want to blame this on mental health. Let's be just very clear about this. Only 4% of violence, okay, is associated with a mental health illness, one of the major mental health illnesses, whether it's bipolar disease, major depression, schizophrenia, and so forth. The majority of people with mental illness are actually more likely to be victims, right, rather than perpetrators. So I just want to be so clear about that piece. But now let's take it back to the schools. We know, right, there was a study that was done in 2020 that identified an increased use of antidepressants among students who lived within 5 miles of a fatal school shooting versus those that lived 10 to 15 miles away, right? There are real repercussions to people that not only have experienced themselves firearm injury, but those in the surrounding communities and areas. And the person who asked the question is asking about the 15 billion towards mental health. The reason that's so important is because we know in general our ability to access mental health as a country is just very poor. My brother's a child psychiatrist, and we talk all the time about the lack of mental health services. And some of that is related to kind of school services, but even in the broader community. So I think it's, again, not one solution, but it's a multifaceted approach for us to really try to tackle this. And it includes a lot of the different things that we said, which is secure storage, extreme risk protection orders, expanding the Brady background check, all those things.
I would also like to add, I think the, sort of this underscoring of different experiences for different communities. So having access to healthcare providers that can provide you with, sort of a medication to help with this experience looks different for different communities. So if I think about the young person in Baltimore who has had experiences several years, Baltimore does that thing at the end of the school year where they honor the young people in the community that have lost their lives to gun violence or to violence in general. I know of different students over years who've lost several colleagues in their, student body population from kindergarten through, graduation and 12th grade. Those young people don't always have the same access to even talk about the challenge that it is. Think of losing a friend to gun violence as a young person, to process that in order to move forward in the way that Joe was talking about. And so I want to highlight that when we talk about the experiences of different communities, young people in Baltimore, while it's not a mass event, experience a lot of gun violence over and over and over again, and are responsible for trying to process that in a way that allows them to be positive learners and engage in school. And if we think about what they need in order to do that, we will look and realize the mental health capacities, the social services, the programs that schools are providing, woefully underfunded, so limited, and doesn't do nearly enough to help those young people. So if we want to stop that cycle, we need to invest in the ability to stop that cycle.
Yeah, I want to thank you, because I think it is important to draw the distinction between as I said, we talked about earlier, the mass casualty events that is happening at an increase in our schools, and the repeated incidents of gun violence that we also see in our communities. While they are distinctly different, the outcome is still the same, that there is trauma that is formed out of this gun violence. So whether it's happening as the result of the mass casualty events or the repeated events that we keep seeing, where 1 or 2 people are affected, but over and over again, the end result is the same. So I want to go to a question about, how do our teachers deal with this? The trauma that our kids are bringing into the classroom are often laid at the feet, as we said, of the trusted adults. many times those are our teachers. Our teachers have so much on them already. We have already seen that we're opening this school year with massive numbers of vacancies across the country. Florida has 8,000 vacancies apparently. Here in Maryland, we've heard that there are upwards of 2,000 as of last week. So we know that teachers are having a response to how the pandemic has really burned them out in many cases, which is what they're saying. Now we layer onto them the responsibility of mediating so much of this trauma. What should our teachers know heading back into our classrooms this fall to help them to be able to respond to the needs of our young people in their classrooms?
That is a loaded question, Dr. Anderson. I will start with, there's two thoughts that sort of come to mind for me. One is this concept of help for the helper. So teachers, in a very real way, and this is one of the reasons I'm super appreciative of them, take on the experiences of the young people that they are working with and for. And that is a heavy toll. So when I talk about the trauma to the young person, I'm also talking about the experiences of their teacher and their educators seeing that trauma for that young person, and how the schools and how the school system chooses to support a teacher in addressing that. So I'm talking about the individual as a teacher first, is extremely important. And there's some work I know that's happened in some schools, around teacher support and teacher guidance, and that needs to happen. Again, that needs to be one of those things that we're talking about and supporting teachers. So if we're going to advocate for funding in a school, Dr. Anderson, you haven't asked about sort of school police and school resource officers, and I don't know if we're going there, but what I will say is the diversion of money to prevent this into supporting teachers is well spent money, as opposed to, and I might be getting myself in a little trouble here, the response in the event that there may be a shooting, especially in cities like Baltimore, to having school police and school resource officers. So the first thing that I would say is the supports for teachers is absolutely critical in order to address the experiences that they're having to help the young people that they're working with. The second thing that I will talk about, and we talked about this a little bit earlier, is around what is the partnerships with community and parents in that space. Teachers are not in this alone. And one of the narratives that I've heard is that it's us against all of them. That narrative is fundamentally destructive for support of a young person as a young person in the school. So I go back to, one of the comments that we made earlier is what's the partnership? Joe talked a lot about the community around the school and how they support the school. What are the partnerships that we can build there? So teachers know they actually have supports in their community and their surrounding environments that allow them to work with a young person to be the educator, because they're not going to solve all the problems for this young person. It does take a village to raise this child, and that teacher should have access to that village to help support them. And so I'll stop there.
If I can just quickly add on to that, because I think those are such great points. And I just have two broad points to add. One is, like, when I think about Baltimore specifically, I think about also people like Alicia Wilson, who is the VP of economics, right? Who I think most of us know and love, right? And, the work that she's doing with businesses, right, to build those partnerships, and how she's using the university to engage in the community. The work, is just selfless and just continues to, I think, drive the needle forward and build those true relationships. Specifically, though, for teachers, Dr. Anderson, I go back to Randy Weingarten, who is, runs the American Federation of Teachers. I think they've done a really terrific job of trying to help other teachers figure out how to navigate the space. And if you go to the website, they have things like, helping children cope with traumatic events and different lessons around gun violence. And they have, their resolutions and their ability, even if teachers want to be advocates and figure out how to be part of that change. So it's a great resource, I think, for people to check out, especially teachers, if they want a little bit more information.
Thank you. So sadly, this hour has flown by. I feel like we need another hour. I feel like we could have several more conversations to dig more deeply into so many of the nuances of the topics that we raised this evening. But I want our last question to be about thoughts for parents going into this next school year. So many parents have reported, for example, that their kids have gone through ALICE training and that has been traumatizing. You also have parents who have said that because of the pandemic and the separation of kids from schools for some time, that they feel like they are seeing more acting out than they have in the past. And then there's some parents that are just worried about what the school year will bring because we've had this pattern of increasing violence in our schools. What words of encouragement, support do you have for our parents as we head into this year and hoping that we're going to have a very positive and productive school year for all of our students across the country?
Well, I will start, and this is something that I've learned over the course of my career working with parents and young people. They are listening to you. I know, especially when they get older, it might not seem that they're hearing you, but when a young person is out in a community or at school, the little voice that they hear when they are making decisions, especially when they're stressed, is their caregivers. It's their parents. You are their primary educator. So if you take nothing from this discussion today, they are listening to you. It does matter. It might not always feel it, but it does. And they are the ones that you're most concerned about.
Gosh, I love that. I was just having that same conversation with someone last week about how when we were younger, our parents never thought that we listened to them. But when we were confronted with a difficult decision, it was that voice in the back of our mind. And it's so true. I would just say, as someone who's not a parent yet, that I just want to recognize how hard of a job parents have in this day and age and the landscape that we're facing. And I would just say, don't give up on your kids, because I can tell you that there's nothing worse in the job that I do when I have to come out and talk to a mom and dad and explain to them that their child that left that morning is never coming home again. And I would just say that, talk to your kids, try to do everything you can to, help them kind of walk that straight line and to understand all the opportunities that they have in front of them. And they will listen. And, no one is perfect, but I just hope that, we don't give up on our young people because of the future.
Wow, powerful. I just want to say thank you to you, Dr. Jones, and to you, Dr. Sakran. It's not often that we get to have two rock stars in the room. And so I just want to thank you both for sharing. This has been such an incredible platform, and I'm so glad that we have the opportunity to do this and to connect with parents and with caregivers and with teachers and educators who have questions about some of these most pressing public health issues and how they affect our schools. So I want to thank you for sharing and taking the time out of your busy schedules to be with us this evening. Your wisdom and insight has been incredible. Dr. Sakran, I didn't realize we also shared a pen connection. So that's why I knew I loved you. It's that Go Quakers connection as well. So I just want to say thanks once more to everyone, to our audience who has tuned in this evening with incredible questions, to our team, our HEAT team, for their production skills. Thank you so much. I just want to thank everyone for joining us. I want to remind you that we will be back next month. Next month, we are going to continue our Fall Town Hall series. And next month's topic is monkeypox, everything you ever wanted to know. So please make sure that you look for our social media postings with the date and time and access, because we definitely want to make sure that everyone has an opportunity to join in to our September town hall. In October, we're going to have a town hall on vaping in schools, something that I didn't even know as a parent was so popular. But again, this is something that we need to pay more attention to as parents and as educators, because it is impacting our schools. In November, we're going to host a town hall on schools and mental health. And so we invite you to stay with us monthly as we continue this series in our town hall. Follow the JH Heat Corps on Instagram, Twitter, and Facebook. And if you have any questions, please feel free to email your questions to heatcorps@jhu.edu. I want to again say thank you to the Johns Hopkins University in Medicine and the Johns Hopkins Health System for all of your work to support us as the Johns Hopkins Heat Corps continues to focus on health literacy in our community. Thank you, everyone. Good evening.